Greetings, my name is Candice Dip, and in today's video I'll be demonstrating first aid for persons with a heart attack. So heart attack is also known as myocardial infarction. It is the decrease in blood flow that causes damage to the heart muscles. This normally occurs very suddenly, and symptoms that you want to be aware of is pain or discomfort, nausea, vomiting, any chest pain, shortness of breath, lightheadedness or dizziness, and in most occasions sweating. So what you want to do is, before, when you see a person who has had a heart attack, what you want is to evaluate your environment. You want to evaluate your environment, check the surroundings, check if there's anything that can cause more damage or complications. Then you wear your gloves. You don't want to contaminate the person, and you don't want the person to contaminate you. Then you approach the person. Now you have an idea of what to do, right? You approach the person, then you call the emergency services. You call 911, you call 112, wherever you are in your region, the emergency services that are needed to be called, you call them. Then you administer an aspirin to the person. This will help decrease the formation of blood clots in the vessels. Yes, and it will also decrease or prevent further damage. An alternative is nitroglycerin. This is an alternative to ease the patient to ease the patient from further distress or whatnot. So if our patient is not responding to the earlier steps, we want to administer CPR, 30 compressions and 2 breaths. And from there, once our patient is in recovery mode, we position the patient in a recovery position that will allow the patient to breathe well, open the airways and whatnot. So right. So here's our patient. She has just collapsed. We don't know what is happening with her. So the first things first, evaluate the environment. I've evaluated our environment. Anything, her phone, remove the phone, her teddy bear, I remove that. I remove everything from there. I've worn my gloves. What I need to do is, she's in a very incorrect position, so I'm going to position her into supine position, yes. And then her head position, I'm going to a chin uplift, yes. So for to open the airways for clear passages. Now I want to check her vitals. I'm going to listen to her breathing using via her nose. Her breathing is very shallow, so that's the first observation. I want to check her pulse rate now. An irregular pulse. Her pulse is irregular, her breathing is shallow or irregular, and this is to indicate that something is wrong. This could be heart attack. Shortness of breath could be a sign of heart attack as well. So what I want to do, I'm going to give her an aspirin, or if there's no aspirin, I would give her nitroglycerin. And seeing that she's not responding, I'm going to perform CPR between her dominant thingy. 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then 2 breaths. 2 breaths. And then I continue this until paramedics increase. So take, for example, if her condition does increase, I'm going to position her into a recovery position. That would be and then I roll her towards me, and then she will sit in this position until further help paramedics come. Thank you, and I hope you enjoyed today's video.